A surprising new study reveals that exposure to certain strains of E. coli in childhood is linked to a higher risk of colon cancer in adults under 50. Colon cancer is often associated with older adults, but a disturbing trend has emerged in recent years. In the United States, the incidence of colon cancer in adults under 50 is increasing at an alarming rate. According to data from the American Cancer Society, rates of colon cancer in people under 50 have risen by over 16% since 2014. This surge in cases has significant implications for public health and our understanding of the disease. The World Health Organization has also noted a growing global trend, with many countries experiencing a similar uptick in young adult colon cancer diagnoses. The groundbreaking research that led to this discovery was conducted by scientists at the National Institute of Environmental Health Sciences. They analyzed data from over 40,000 participants in the National Children's Study, which tracked the health of children from birth to age 19. What they found was a strong correlation between exposure to certain strains of E. coli in the first 10 years of life and an increased risk of colon cancer later in life. Specifically, the researchers identified strains of E. coli known to produce a toxin called Shiga toxin as the primary culprits. This toxin has been shown to cause inflammation and damage to the colon, setting the stage for cancer development. Perhaps most strikingly, the researchers found that the risk of colon cancer was highest among individuals who had been exposed to these toxin-producing E. coli strains in their first 5 years of life. This suggests that early childhood exposure may be a critical period in the development of colon cancer later in life. Understanding this link is crucial for developing effective prevention and treatment strategies. This groundbreaking research has far-reaching implications for how we approach preventative care, particularly for young children. Traditionally, colon cancer screenings have been recommended for adults over 50. However, given the new evidence linking E. coli exposure in early childhood to a higher risk of colon cancer in adults under 50, we must reassess our approach. One potential strategy is to incorporate E. coli testing into routine childhood health checkups, allowing for early identification and intervention. This could involve stool samples or other non-invasive tests to detect the presence of high-risk E. coli strains. Additionally, public health campaigns could educate parents and caregivers on the importance of maintaining good hygiene practices, such as frequent hand washing, to reduce the transmission of E. coli in childcare settings. By taking a proactive and preventative approach, we may be able to break the link between childhood E. coli exposure and colon cancer risk in adulthood. By doing so, we can potentially save countless lives and give young generations a healthier future. Breaking the cycle of disease, we're at a critical juncture in understanding how early exposure to E. coli can have long-lasting consequences for adult health. By recognizing this link, we're presented with an opportunity to rethink our approach to disease prevention and early intervention. One promising area of research involves identifying specific E. coli strains that are commonly found in early childhood and their corresponding risk factors for colon cancer. This could enable public health initiatives to target specific populations and develop targeted prevention strategies. Furthermore, we're beginning to see a shift towards a more holistic understanding of health, where childhood experiences are recognized as a crucial determinant of adult disease. If we're able to break this cycle, we may be able to prevent millions of cases of colon cancer worldwide. But it's not just about the science. It's also about rethinking our societal priorities and investing in the health and well-being of our children. By doing so, we can create a healthier future for generations to come. As we close this chapter, it's clear that the link between childhood E. coli exposure and colon cancer in young adults has profound implications for public health. By integrating early childhood health strategies into preventative care, we can break the cycle of disease and create a healthier future for generations to come. It's time to act.